So we will be going through Dr. Hansra's journey to medicine, taking care of your skin, as well as just practicing medicine. And then at the end, we'll just go over some Q&A. So if you can just add in anything into that Canva chat, that would be great. And then we'll have a few minutes at the end to just go over that. Just refrain from asking for any personal medical advice, but feel free to ask anything that you'd like from what you hear from this webinar. All right, so Sahej, you can take it away.
Hey guys, thank you for coming today. Yeah, like Amik said, big thank you to Dr. Hansra for agreeing to do this and taking time off your schedule. And yeah, so we're splitting up this this fireside chat into three parts. First, we're going to be talking about Dr. Nina Hansra's journey to medicine, then taking care of your skin, and then her actual practice as a board certified dermatologist. And we had almost 100 questions to go through, but we could only pick a handful that we're going to be discussing in the beginning. And like Amik said, we'll have a Canva Live Q&A at the end. So just some introduction on Dr. Hansra. She's a practicing board certified dermatologist in the Bay Area. She studied biology and religion at USC, completed medical school at UCSF, completed her internal medicine internship at Stanford, and finally her dermatology residency at UCSF. You could follow Dr. Hansra on Instagram at livinthederm. So yeah, the first question for Dr. Hansra, how are you doing today? And would you like to say anything to the audience before we get started with the questions we have?
Well, thanks for having me. It's really my pleasure to be here in front of this audience because you guys are really motivated at this stage in your life. You guys have endless possibilities of what you can do, both for your career and what you can do for society. I think there's a lot of room for growth and change in this country and world, and you guys are our future. So I'm really privileged to be able to talk to you guys today.
Okay. Yeah, so starting off, like you're saying, most of us are pre-meds or in college, and a common question that we got is, as a pre-med, you being one yourself at USC, is there any general advice that you would give to someone who's aspiring to be a doctor, whether it's specific to dermatology or just in general? And
go ahead.
oh yeah, and if you could talk a bit about how you know if medicine is right for you.
Yeah, I would definitely say that I guess I didn't know I wanted to be a dermatologist actually until much later in medical school. So I'll just address the question from the perspective of like, how do you know you want to go into medicine and not dermatology at this point? But really, I wanted to know, I personally knew I wanted to be in medicine for like since I was a young kid. I really liked math and science. I really liked to help people, and it was just a really good fit. I went to USC. There was an 8-year baccalaureate MD program. So I kind of already knew I was going to be going or headed to medical school, even in high school. So my journey was a little different, but that said, I still made the most of my undergrad. And I, in fact, didn't even stay at USC. I decided to come back up north to UCSF, although I could have stayed there for the full 8 years. So I still will speak to my journey. I really would say the number one thing is don't give up. If you really have the determination and motivation to be a doctor, you can be a doctor. It does require a lot of hard work and a lot of studying, a lot of, I feel like sleepless nights. I definitely remember that in undergrad. It's really hard to become a doctor without putting in the work and the effort, but it's possible. Like, I feel like if you are determined and you work hard, you can do it. So that's the first thing, is don't let anyone ever bring you down, because there are people along the way that may discourage you, and you need to tune out sometimes that background noise and really stay true to yourself and your dreams. As far as other advice, I would say study. I mean, studying is really important in undergrad, because no matter what people do look at grades and MCAT scores. I definitely don't think that that is the end all be all. I think that there's a lot of room for standing out in other aspects on your application, but I still believe that, you know, studying and working hard is important. And I know you guys know that. So then the last thing I would say is finding a mentor is key. I really attribute my journey into medicine to my mentors. And those mentors are the ones that are going to bat for you. They're going to call programs on your behalf. They're going to write really strong letters of recommendation. They're going to make opportunities happen for you, help get you on publications if you're doing research with them. And they guide you and really are your supporters. And so I really encourage people to find a good mentor.
Yeah. So as an undergraduate, and you know, you kind of, I guess, had a sense that you wanted to go into medical school when you're an undergraduate. Do you think there are any experiences at USC that kind of prepared you for medical school?
Yeah, I volunteered in several different hospitals. I'd say even actually I did that in high school. And so getting that firsthand exposure to medicine by working alongside doctors, nurses, LVNs. I mean, I remember working at like the front desk, receptionist desk, and, you know, helping tell people where to go into the hospital. But any exposure, I think at that stage is really important to see if you even like the environment. It obviously helps build your resume, no doubt about that. And I also think research is helpful. I definitely don't think you have to do research because that question comes up a lot. Like, I don't like science. I don't like to do the research part of science. Like, do I really have to do it? My answer is no, you don't. But I think it's nice. Like, how do you know you don't like it until you try it? Because I wasn't sure if I liked it or not. And I tried research. I did neuroscience research and I actually ended up really enjoying it. My job now has nothing to do with basic neuroscience research, but I really appreciate the experience of learning about basic science from behind the bench. So I think that's also something to at least try while you're in undergrad, at least be open to it.
Hmm. And yeah, and one, I think, unique experience that you might have had was being a double major in both biology and religion. So I was wondering did you find these two studies to be interconnected in some way, or if...
Yeah, no, it's a really good question. So I went to an all-girls Catholic high school and really loved theology class. And so when I went to USC and I, you know, like I mentioned, I really knew I wanted to be a doctor, but then I really wanted to explore another subject that interests me personally on a level where I didn't even think connected with medicine at that age. So I started taking classes in religion, and then that led to actually me discovering classes in medical ethics, which happened to be part of the religion major. And I think that worked out really well because I definitely saw an intersection there. I mean, medical ethics is something that pervades medicine on a daily basis, some more fields of medicine than others. But I got to really discover medicine from that point of view of you ask these questions about, you know, there's so many questions about, is this right or wrong? And there's, you know, sometimes medicine is or appears to be black and white with answers, like you check a lab and you know the answer. But this part of medicine was more gray, and that really intrigued me. And there's definitely a role for that. And I would actually encourage all of you that if you have some subject that interests you, go ahead and explore and dive into it. You never know. Those subjects can come back and really integrate into your future career as doctors. And I actually think that could help stand you apart from other applicants because you're exploring something unique, you offer something different to medical schools, or it's just interesting. And they like the fact that you had a passion and you followed through with your passion. So it doesn't have to all be medicine and science. It can definitely be outside and seemingly have nothing to do with medicine, and it still could help you. Just aside from you fulfilling your passion, there may actually be a role in your application to talk about it.
So moving forward, away from your undergraduate experience and talking a bit about your experience at medical school. So one question was, you completed your internal medicine internship, and then you had your dermatology residency. So does that mean that you initially were matched into internal medicine and later worked to pursue dermatology, or like how does that path look?
Yeah, that's a really, really good question. And so when you match into, for instance, certain specialties like dermatology, radiology, there's certain specialties that you match into that require a 1-year internal medicine intern year, like an internship. And so that's required before you can start your more specific residency. So in medical school, when I was applying for dermatology residency, while I was applying for that 3-year residency, I was at the same time applying for an internal medicine internship, and you have to match into both to make it work out. So the internal medicine internship comes first for a year and then followed by a 3-year dermatology residency. Not everyone matches in dermatology or other certain specialties. And so then what those applicants will do is they'll hopefully match into an internal medicine intern year, and they'll do that year. And while they're doing that year, they again try and apply for whatever specialty they're interested in. That's just kind of how the specialties work. And it is confusing, but it's nice because it gave me that background in internal medicine, which is a good building block for just being a doctor. I mean, it's good to like take care of sick patients in the hospital. It's good to understand like the key aspects of internal medicine, because even in dermatology, I see patients obviously with a history of high blood pressure or diabetes. Now I don't manage their blood pressure medicines or their diabetes medicines, but sometimes those diseases overlap with what I'm seeing. Maybe I'm seeing a medication drug rash from their antihypertensive medicine. And so that way I at least have that backbone to know like, okay, so that's what this blood pressure medicine does. I definitely think that there's an alternate medicine that this patient could be on. Let me talk to the primary care doctor to switch the blood pressure medicine. And then we can kind of go from there versus, oh, this medication is really essential. There's not really a good alternative. I need to manage this rash from a different perspective because this patient has a life-threatening disease. And if they're off the medicine, then they may not survive. They may need a liver transplant. I'm thinking, of some cases that I've encountered over the years. So I think that year is actually really important.
And I think the most common question we got by far was, what kind of compelled you to pursue dermatology, and how did you know, and when did you know that this was the field that you wanted to pursue?
Yeah, so I would definitely say that my exposure to dermatology started, I'm trying to think when it started. So I did a lot of homeless clinic volunteering in medical school. At UCSF, we would volunteer. There was this homeless clinic in San Francisco, and one of the homeless clinics was a dermatology homeless clinic. And I believe I did that toward the end of my 3rd year of medical school. And 3rd year is the year, there's 4 years of medical school. The first 2 years are spent just studying, learning all the fundamental like scientific principles of medicine. And then year 3 is spent on clinical rotations. And on the core rotations, core meaning pediatrics, family medicine, internal medicine, general surgery, psychiatry, and OBGYN. And then you can do a couple like shorter 2-week electives. So I did a 2-week elective in, I think, anesthesiology and dermatology. And dermatology was my last 2-week elective of the year, of the 3rd year. And so all the way up until then, I thought I was going to be an internist, meaning go into internal medicine, practice primary care. I was really enthusiastic and excited about that field. And given that exposure I had to the homeless clinic, that's what prompted me to even sign up for the 2-week derm elective. And I did the elective, and it turns out that I really liked it. I think my impression of dermatology initially was that it's very cosmetic heavy. It's too easy, meaning all they do is treat acne, and I feel like I need something more intellectually stimulating. I think I kind of thought of that just from a very superficial outside perspective. And I did the rotation and I realized that there were a lot of intricacies in the field. And I almost felt like I was the doctor's doctor. So meaning for the primary care doctors, I became their doctor, that they would look to the dermatologist and say, hey, this patient has this rash, super sick patient in the hospital. We've consulted on multiple specialties. We have no idea what's going on. And instead of the patient getting a kidney biopsy, how about you guys do a skin biopsy, and maybe that will unlock the, what actually is happening with the patient. And a skin biopsy is much of a simpler procedure, less invasive to do for the patient than like an organ biopsy. So I commonly would go and, I shadowed this really renowned hospitalist dermatologist at UCSF. And so we practice all this really complex medical dermatology on the rotation. And I realized like these people are really cool. They know a lot of medicine, and they're able to help these doctors who aren't able to figure out these things just by the physical exam on the skin. And so that really excited me. And then in my 4th year of medical school, I had an internal medicine rotation plan. So I did that 4-week block. And then I last minute changed the schedule to a 4-week dermatology block. And those 4 weeks, I spent a lot of them with this hospitalist dermatologist in the hospital. And again, my passion for the field grew. So I really enjoy practicing complex medical dermatology, where we do, take care of some sick patients. I love general dermatology. Actually, for all that it started with, I actually really find a lot of joy in treating acne. So I feel like acne affects people of so many different age groups. And when I help improve acne, it just improves the patient's self-confidence, and they feel better about themselves, not even just physically, but also it just internally. I mean, you can see how happy it makes people. So I found a lot of joy doing that. And I also found a lot of joy in dermatology. We take care of people of all ages. So that's pretty unique to this specialty. Unlike internal medicine, where I was only going to be taking care of adults, in dermatology, I take care of newborns, kids, all the way to like 100-year-old patients, because everyone has something on their skin at some point in their life, whether it's, at a younger age or an older age. The skin definitely comes up in life in people. So I loved forming relationships with all ages. And then I also really enjoy some patients just come there to see me one time. Some patients have something that a chronic skin condition that they're seeing me for years and years. So I like the variety. I do a lot of procedures. I do a lot of skin biopsies. We do cosmetic procedures. I do surgery. I cut out skin cancers. And patients tend to be overall healthier than, some of the other specialties. We still do see some of the sick patients, but not nearly as many as some other specialties. And for me, I just enjoy that population more. So there were a lot of reasons that factored into that decision.
Yeah, definitely. I would imagine that it's a multifaceted decision to make. Moving on, and you touched on a few things like acne, and kind of consulting with other expertise, which we're going to get back to in a bit. So I'd like to move on to part 2, where we talk about just the dermatology specific questions we got, as well as taking care of your skin and your hair. So one question was, are there any skin problems that individuals with brown skin color are more vulnerable to? And if there's any general precautions or routines those people should follow?
That's a great question, because I think, brown skin, you think you're protected against, for instance, skin cancer. And it is true, we all have more melanin, and so that does protect us. So I think on a baseline, there's definitely that advantage. But I still believe very strongly that despite having brown skin, or any shade of skin, basically, you should be protecting yourself from the sun, because the sun's rays are damaging for all skin types. And not only would that protect you from skin cancer, but that also protects you from aging skin. And maybe at this age for you guys, it really doesn't seem like it would matter a lot. But years and years of sun really does affect how you look. So maybe when you get to my age, it like shows way more. And so one thing I would really encourage you guys at this age is whatever you do, protect yourself from the sun because it will catch up. And in terms of what conditions brown skin is more predisposed to, I'd say the most common thing would be hyperpigmentation or brown spots or dark spots. So whenever someone breaks out with acne or you go out in the sun, you're just more prone to getting like brown spots from any sort of rash or pimples or just even sun exposure. And so I would say pigmentation issues is what I would more commonly see in brown skin patients.
Okay. And moving on to now how to address some of those issues.
Yeah.
How do you know whether a skincare product is effective and it's not going to harm your skin?
Okay. So there's, this recent trend for like clean beauty products. And the concern that I have with, the marketing for clean beauty products is the FDA doesn't have any sort of regulation or even definition about what it means to be a clean beauty product. So, you'll see the social media influencers, celebrities, companies, they're selling these products and the consumers look at it and feel like, okay, this is good for my skin. It's clean, it's natural, it's organic. Like, I don't want to put any of those chemicals on my skin, like sign me up. But the problem with those clean beauty products, like I said, they're not regulated. And just because a product maybe, let's say, contain an organic ingredient, like, tea tree oil, lavender. I mean, these are certain common things that we see. Those products actually may not be good for your skin. And there's a lot of allergens that are out there on the skin, and those allergens tend to be the organic things. So tea tree oil is an allergen for people. And so rubbing tea tree oil may seem like it'll help the foot fungus or whatever, you're trying to treat, but then it can cause an allergy on your skin. So I definitely feel that the one thing is I'd be wary of those clean beauty products and really kind of assess what products are more regulated, and seeking the advice of a physician is helpful if you're not sure. So that's something to keep in mind. The other thing is, you think, oh, for instance, I'll give you a very common example, petrolatum or Vaseline is not safe for the skin because, you read things about it, it's not safe. But the real truth of the matter is, like you talk to any dermatologist, we love Vaseline. Probably my number one favorite product. It heals wounds, it helps certain rashes, it definitely clogs pores. So if you have acne, like don't put it on your acne. But it does help certain types of skin conditions or dry skin. So I think it's really sometimes hard to know what's safe and what's not just by looking at the label and thinking it is okay just because it's organic. I'd be wary of those, like I said.
Mm-hmm. And yeah, so just looking at the description maybe on the bottle and the way it's marketed might not be accurate. I would assume, like, is there maybe websites or you could just search online and get a sense? And would you say that each individual might have different responses to different products? And is that a significant thing to factor in?
Yeah, so each individual does have different responses. Absolutely. I would say there's certain products that are definitely dermatology approved and tested and recommended. So there's, certain products, I mentioned Vaseline or Aquaphor ointment. Those are very basic, cheap, easy to find products. Cetaphil, CeraVe, Eucerin, Vanicream, again, brands that are good for sensitive skin. They make some really good products for different types of skin, whether it's oily or dry or combination. So you kind of want to stick to just basic stuff. I mean, honestly, in skin, less is more and being basic is okay. Things you do not need to break the bank to take care of your skin. I mean, a lot of the other products that are marketed for, like I said, the clean or just high-end products, that doesn't necessarily mean it's better. It's all marketing.
Mm. Yeah, and you talked a bit about this in part one. One of your specialties is acne, one of the most prevalent skin conditions. So what would be a general recommendation that you would recommend for those with acne or someone who's just trying to prevent themselves from getting acne?
Yeah, so there's a lot of really good products over the counter. So you really want to try to, and again, it also depends on what kind of skin type you have. I mean, I definitely, if I'm talking about acne, products that may be good for some people are not going to be good for others. For instance, like some people have sensitive skin and their skin is prone to eczema. So then some of these products that I may be talking about are going to be too harsh for your skin. So it could be very difficult for me to generalize for a whole group of what products I would recommend because it does depend on the skin type. But general rules that apply is you want to find something that's oil-free or non-comedogenic. So meaning it doesn't clog your pores. Vaseline would be an example of the opposite of that. So you would want to find, for instance, I gave you some brands that I like CeraVe. They make face washes and lotions and creams that are oil-free, non-comedogenic. So people who have acne definitely could use that for moisturizing. They make a foaming facial cleanser that's good for normal to oily skin, but they also make a hydrating facial cleanser that's good for dry skin. So some of the products, like I said, do vary, but you just want to make sure the stuff that you're putting on is oil-free. That's one key principle. The other thing that comes up, and then there are actually products over the counter like benzoyl peroxide, salicylic acid washes, glycolic acid, retin-A, which is prescription, although there are retinoids like retinol or Differin that are over the counter. Those products are great for acne, but they can really dry out the skin and cause irritation. And they're not safe in pregnancy. So there's a little bit of a conversation I have with patients in terms of who's a good candidate for these. But there are a lot of really good over-the-counter products. And then I really recommend sunscreen because sunscreen will prevent the brown spots that you're getting from your acne from getting darker. So protecting your skin from the sun is also important. And the final thing I was going to mention is a lot of questions I get asked are related to diet and can anything be done just with diet modification to help acne. And there are some studies that have shown a low glycemic diet can be helpful in reducing acne breakouts and actually reducing the number of medications you're on. What does that mean? So low glycemic would mean avoiding foods, with a high glycemic or sugar index. So that would include like pastas, rice, obviously sweets, potatoes or French fries. So avoiding all these yummy things can actually reduce your breakouts. The other thing that's really interesting is there's been a link between acne and milk. And it's not dairy, it's milk specifically. So not, like yogurt or cheese, but and within the milk category, it's thought that skim milk is more likely to flare acne than like full fat milk, for instance. But in general, I would encourage patients, if you want to try something at home, would be a low glycemic diet and a diet free of milk. Finding the milk substitutes may help. And it's not known why there is that connection with milk. Some people hypothesize that it's hormonal based because, milk comes from cows and there's obviously hormones associated with that. But something to think about for those of you guys who are struggling at home and want to try something at home.
And yeah, and going into diet, do you think like your plant-based eating has made a difference in terms of skin health or just lifestyle?
Yeah, I think plant-based eating or a diet that's healthy helps your skin. You are what you eat, and that includes your skin. So whatever your skin is, it's a reflection of your nutritional status on the inside. And so if you have a diet high in, for instance, antioxidants, you are omega-3s, you are actually eating foods that are more protective for aging skin. So a diet like fruits, for instance, foods high in antioxidants would be strawberries, blueberries, plums. That's just an example. Foods high in omegas, which are good for you, would be flaxseed, vegetable oil, walnuts. So I think drinking a lot of water obviously clears out the toxins from your skin. Green tea has been associated to have a protective effect on the skin. So I think having that healthy diet is really, it's good for you in general, but also obviously has health benefits for your skin.
Okay. And moving on from the dermatology part, going to part 3, talking about your actual practice of medicine. So I guess one thing that's really relevant right now is the pandemic. And how has the COVID-19 situation affected your job as a dermatologist? Do you physically go to your clinic?
Yeah, so half of the time I go to clinic and see patients, and we're fully gowned up and all this protective gear, which I appreciate because it protects us and it protects the patients. And then half of the time I'm working from home. So that's been really a nice flexible option in dermatology where I do virtual visits. So that's just basically me sitting here on my laptop and then having visits with a patient over the computer. And that's been great and works well for certain skin conditions like acne. I mean, I don't think you really have to come to my office to see me in person, honestly, anymore. If you have acne, I think I can do a very good job of treating that from your room, which is convenient. And then we also do what's called teledermatology. And so teledermatology basically involves reviewing photographs that are sent by primary care physicians and then being able to make a diagnosis or a plan. So, and it's a good way to triage patients. So if a patient has a really high risk concerning skin lesion, I know, okay, that patient needs to get bumped up in the line and get in to see a dermatologist like ASAP because I think this is life-threatening and we need to address it right now. Versus, okay, this patient needs to come in for a skin biopsy. We need to evaluate this skin lesion and make sure it's not a skin cancer, for instance, or other concerning skin rash or condition. And then otherwise, I can provide recommendations to the primary care physician and say, hey, this looks like this rash, and I would recommend these things. And then if he's not better in 2 weeks, please let me know. And then we can arrange for more follow-up for the patient versus, oh yeah, that's a benign growth. You can reassure the patient, this is what it's called. And so we get to do a lot of that over photographs. And a lot of our, I'm grateful to be working in a place where we do have access to high resolution photos with what's called dermoscopy, where there's like a magnifier that's basically like a magnifier that is used to take pictures of the skin lesion. Obviously those are if the patient is able to come into a clinic to get those photographs taken that way. But, and we also, our video visits are high resolution too, or can be high resolution depending on what the patient has access to on their computer. And so we can do a lot just from virtual visits.
Mm-hmm. Yeah. And going away from the COVID situation, a typical practicing dermatologist who isn't necessarily doing teledermatology as you're talking about, how is the lifestyle of being a dermatologist? Are there long hours? Does it get, some burnout is a common problem?
I see. Yeah. So typically like pre-COVID, we didn't do virtual visits, but we did still do teledermatology because we still are able to help provide that support to primary care physicians. And that's still, it was popular, it remains popular as an option to have easy access to our field, just because it is a field where there's not a lot of dermatologists. That said, we do work hard. When we're at work, we're like on the go, seeing our patients back to back, no breaks. But the nice thing about the field is then when we're done, meaning I don't have to go. I rarely get called in to see a patient, for instance, when I'm on call. So I don't really work nights and weekends. And so I think that helps prevent a lot of that burnout. But like I said, when we're on. But then I think that definitely balances and makes up for the fact that we don't work nights and weekends. I feel like it's a very nice work-life balance.
Mm-hmm. So yeah, and you talked about this before in part 1, So as a dermatologist, what are some specialties that you consult for that are very common? And a follow-up to that is, were there any unexpected situations or cases that required your expertise in dermatology that might not have been apparent at first?
Oh, I see. Yeah, I mean, I guess I touched on that with the hospital calling us. You don't normally think of a dermatologist going to the hospital, but we definitely have that role with the hospital. And not common, but it's there. And when it's there, I feel like it can be valuable. We interface a lot with rheumatology. And rheumatology is a field of internal medicine or a specialty where they take care of certain like autoimmune illnesses like lupus would be a common example. And so some of the overlap that happens with those patients and their internal organ issues, we may sometimes even be the first one to diagnose because it originally will present on the skin, for instance. So when we make the diagnosis and we send them to rheumatology, but then we obviously converse back and forth on those patients. And that's kind of nice about working in a multidisciplinary clinic where you have access to these specialists and you commonly write messages back and forth or have phone calls with the other specialists to coordinate the care on a patient.
Yeah, that covers every question that we had prepared. I think Amit got a few questions through Canva, so I'm going to hand it off to Amit.
Yeah, there are some great questions on here, so I'm gonna enlarge some of them. And I think here's the first one. Can you see it? I could read it out loud as well, but it should be on the screen. But it's the main question is haldi really good for our skin? And a lot of people use lemon in face masks. Is that okay?
Okay, good question. Yeah, I didn't touch on the haldi. Hold on a second. My battery. Okay, there we go. So that's the question. Okay, so haldi, I'm not a fan of haldi on the skin personally because it can stain your skin yellow. And obviously that's more proportional to how long you leave it on your skin. I personally don't like the smell of haldi either. I mean, I think it's great, like cooked into your sabji and dal, but like, I don't want to put something that smells like that and colors my skin in that way. So I personally wouldn't recommend using that on the skin. And I think I was kind of already alluding to the fact that certain things can, even though they seem organic, can actually be allergens to the skin. So that's my take on haldi. Although it has been shown, like in India and people who've used it, to have properties that can be helpful for even acne or good for oily skin. So there is that, but I've never recommended it. And I think there's a lot of like really cheap and good tested alternatives just on the market, like in drugstores. Regarding the lemon in face masks, I'm not a fan of lemon on the skin actually, and partly because lemon can cause something called phytophotodermatitis. And basically that's a fancy name for a condition that you squirt, like let's say you squirt lemon or lime on your skin and then you're out in the sun. There are certain patients where that interaction between the lemon and the sun can cause pigmentation in the areas that the lemon was applied to. So I would try to avoid that for that reason, because you definitely don't want to be one of those where you discover that like, oh shoot, like I've been exposed to the sun with the lemon that I squirted on my face and now my whole face is pigmented. That's just not a good look probably, and it's very avoidable.
All right, and I guess just going off of skincare, another question was about alternatives to milk. So for both lactose intolerance and acne reasons, what would you recommend as an alternative that is good for general health and isn't profoundly different?
Okay, so good question. I think you could definitely try almond milk. I would say that's definitely a favorite of mine, even as an alternative. I really like almond milk. So that would be one alternative. Another common alternative.
Okay, I think there must have been some technical difficulty on Dr. Nina's end. So let me see what happened there. If y'all just don't mind taking like a minute break, we'll be back soon, hopefully. All right.
I'm so sorry. I had an issue with the connection. Yeah, so soy milk would be the other alternative.
Right. And then another question also regarding skincare is that some skin products like moisturizers have SPF in them. Do you believe that these products are okay as responses to sunlight, or is proper sunscreen a must?
That's such a good question. Sunscreen is a really important topic. So I'll try to hit the highlights of sunscreen because I know our time is kind of getting shorter. Basically, I would recommend, I do think sunscreen can be in your moisturizer, but here's the deal with sunscreen. It should be SPF 30 or more. And the amount of sunscreen that people put on is almost never equivalent to what is the SPF is studied to be effective for. So if you want to have the protection that SPF 30 is studied to protect you for, that means you would have to put an equivalent to 1 ounce or 1 shot glass full of sunscreen onto your entire body, like if you were going to go out to the beach in a bathing suit. And no one ever puts an ounce of sunscreen on them when they're going to the beach. So I think because of that, either you put extra sunscreen on your face, for instance, but then that would mean extra moisturizer because you're obviously combining the two. Or you can get an even higher than SPF 30 to try to bump up how much protection you're getting if you're not putting like what you feel like is probably the recommended amount of sunscreen to get the effects of it. So for instance, you can go to like SPF 50. Obviously, the higher and higher you go in SPF, the thicker the sunscreen becomes, and then it's not as elegant and doesn't feel as good on your skin. That's one thing. The sunscreen should be applied every 2 hours because it only lasts that long. And then the other thing is there's a difference between what is called the mineral sunscreens and chemical sunscreens. The mineral sunscreens contain, for instance, zinc oxide or titanium dioxide. And then the chemicals have there's tons of different chemicals that can be included in sunscreen. And that's how they block the sun, is by absorbing the sun's rays through the chemicals. The jury is still out in terms of the studies, but the chemicals that are in sunscreen have been shown to actually be in the bloodstream of patients. And so now the question is, what does that mean? Are these chemicals safe that they're in the bloodstream, or should these be completely avoided? Studies have to occur on actually the safety of them, so no one really knows. But then my thought is that if you have the choice, then why not just use a mineral sunscreen until they figure out the answer? And so, like I said, the mineral ones are the zinc oxide, titanium dioxide. The other thing to know about the mineral sunscreens or in general about UV, ultraviolet rays, the sunscreen should be protecting against UVA and UVB. That's called broad spectrum. And so that is pretty much what the sunscreens are right now that are out there. However, they don't necessarily all protect against visible light. So visible light is like the light bulbs in your room, the blue light that's coming from your laptop screen, for instance, that we're all staring at right now. And so you may think, oh, I don't need sunscreen because I'm indoors, but actually you do want to protect yourself even from the light, the visible light inside your house. That is because that light can cause photo aging or aging of your skin. Now that's not going to cause skin cancer like the UV rays, the ultraviolet rays of the sun, or what tanning beds do, which is even worse. But these the visible light can cause pigmentation. It can cause a skin condition called melasma, which I see a lot of in brown skin. And so what you're going to look for in your sunscreen are sunscreens that contain iron oxides. And those sunscreens that contain iron oxides, which you would actually see in the ingredient list, tend to be the tinted sunscreens, which I think actually work out well because with our skin type, you really want to wear a tinted sunscreen. It'll just look better. It'll match more on our skin than like, you know, the zinc oxide, which is literally like a white cast that doesn't look very good. It doesn't blend in at all. So I really encourage you to look into the tinted ones for that reason.
Great, that's really cool. And the next question that was asked twice actually was more related to pre-med, but how can I find a mentor during my undergrad pre-med career? And a follow-up question to that was apart from research.
Apart from research?
Yeah.
Okay, that's a good question because I feel like one way to really connect in undergrad is with research. That's my personal experience though, because you're really helping the research professor by doing something that will further their own objectives. And then in return, they're giving you their time, which is mentoring you, giving you advice, writing you these, you know, an awesome letter, calling on behalf of schools, reading your personal statement. I mean, mentors obviously are busy people, and some people honestly are just awesome and they're just going to do it because they really want to mentor you. And I think actually a lot of the people are like that, I should say. But sometimes there's always like, well, you know, how you want to be able to somehow give something to them, or at least that's how I was. Like, I didn't want it to only be a one-way street where I just have this mentor, but then I'm not able to contribute or give anything back to this person. And so I found research to be a really easy way to connect with someone. And then it's an excuse or an opportunity to see them often because you're constantly like working with them. If you're not able to do it through research, then I probably would recommend getting to know your teachers, your professors in class. And so maybe setting up a time to meet with them and say, hey, you know, I just really wanted to hear about how you became a professor. What was your journey like? Or, hey, can we review this really complex topic that you just talked about in class? I really need some more time to like think about, you know, this subject, and just trying to find a reason to even set up a meeting with them, and then making that connection and maybe trying to do an ongoing meeting, maybe every, I don't know how often you would feel comfortable requesting that meeting. And then finally, there's other extracurriculars. So maybe finding a mentor if you have a hospital or a clinic that you're volunteering at. That would also be, you know, or like, for instance, I did a lot of work in a homeless clinic. And so I ended up having a mentor through that homeless clinic experience who was a dermatologist. She was the chief resident in dermatology, became a professor of dermatology at UCSF. And so she was someone that I worked a lot, just again, volunteer wise. So trying to seek them out, and even a volunteer opportunity would be kind of cool.
All right. I think that's all the time we have for questions. And I know there were so many of them. So thank you to all of you who did ask these amazing questions.
Good questions. Yeah.
No, I forgot to change the slide, but thank you so much, Dr. Hansra, for coming and speaking to us. And thank you to all of you who came to the webinar as well. This was such an amazing and so insightful experience. I know for me as an undergrad, and I'm sure for many of us here. And yeah, thank you so much. And we recorded this, so hopefully that will be accessible to all of you soon.
Great. Thanks so much for having me, you guys. Good luck with everything. I'm just really hopeful for you guys. Like I said, you guys are our future, and I'm just really excited that I got to do this.
Thank you so much. It was awesome having you as well.
Great.
All right. Bye.
Bye, you guys. Okay, take care. Good luck. Bye.